Just a quick reminder that our office, both here in Washington and in Columbia, both offices remain open. My staff is working, responding to every email and answering every phone call. And part of the way that I'm spending this time during shutdown, when votes are canceled and hearings are canceled by the speaker, is calling my constituents back to have conversations. So on today's episode of Calls With Your Congresswoman, we're going to call a few constituents back from across the 3rd District.
Hello.
Hi, Ms. Zolotorow. This is Sarah Elfrith, your Congresswoman. Well, first of all, thank you so much for calling us. Would you mind sharing your thoughts on the shutdown and why you reached out?
Well, of course, the shutdown will literally throw people off their health insurance. They will double or triple the premiums for people that do have it. I was uninsured for 8 years, and I know what it feels like. I didn't go to the hospital unless I thought there was a chance I might die. I was lucky enough to get onto the expanded Medicaid with the Affordable Care Act, and a year after that, I was diagnosed with an aggressive form of breast cancer.
Oh my gosh.
So without the Affordable Care Act, you would not be speaking to me now. I would be dead.
Well, fortunately and unfortunately, that's a story I hear quite often, and I'm just glad that because of the ACA to begin with, that you were able to get coverage and the treatment that you needed. And I just want to say thank you for making sure that your story is known, because as you said, if we don't act as Congress to extend these tax credits, I just got the latest numbers this morning. Folks who are on the exchange who benefit from those tax credits, which is 190,000 Marylanders, their premiums would go up by 95% on January 1st if Congress doesn't act to extend these tax credits. But even for folks who are not in the exchange, their premiums are going to go up 27%, or roughly just over $1,000 annually a year, which is just not a hit financially that many people can take. So,
and now I'm a senior citizen, and when it comes to where I'm on Medicare and I have partial Medicaid.
okay.
Medicare Extra Help pays most of my medication bills, which for this year came to $14,000.
Oh my gosh.
I cannot afford that out of pocket. And I am also on food stamps. And cutting these programs, basically, I think Trump and his Republicans want me dead so they can decrease the surplus senior population.
Well, they certainly aren't looking out for the folks in our communities that need the support the most. And while you live in Maryland, these cuts are really going to impact rural parts of the country. Especially in places that don't have access or nearby food banks or don't have the social safety net that Maryland has, and that's what's really, really devastating in this moment. It's why we fought so hard in July, why we're with the president's big ugly bill. It's why we're fighting hard on this shutdown. So I really appreciate you reaching out to my office. If we can be of help to you at all, please don't hesitate to call back, and we're here to support you in any way we can.
It would help if you just stand up and refuse to cave.
I appreciate that, and it's calls like that we got from you and so many others that are giving me that strength right now. So thank you.
You're welcome.
Okay. Well, I hope to meet you in person soon. Thank you so much for reaching out.
Thank you.
Okay. Bye bye.